module. This module will basically consist of a PowerPoint presentation in which I'll explain some basic first aid rules, and then we'll explore some situations that can occur and how you should act specifically in those situations. So since it's a very theoretical presentation, if you have any or you want, I'll try to make it interactive, but it's mostly like pretty straightforward. There isn't much to interact on the rules and how to act in case someone is choking, for example. So if you have any questions or you have anything to say, please interrupt me and we'll discuss it, or I'll explain as best as I can an answer to your questions. I'll start by sharing the screen to my PowerPoint presentation. I'll try. Can you see it?
Yes, we can.
Good. Okay. So, first aid is the immediate help that you are going to give to a victim of an accident or of a disease that you weren't expecting the person to have. And it's not differentiated help, and it's not supposed to be differentiated help. Your goals are simply to keep the victim alive until help arrives, avoid that the deterioration of the victim's state, make sure that they get to the differentiated help that they need, and promote a fast recovery of the illness or lesion. You don't need any equipment to deliver first aid usually. It's most often delivered to a friend or a family member, or in this case, in UIP context, to a delegate, an organizer, someone that's not feeling well and in an IS session with 9-10 days. What to do or how can we help? So, in an emergency situation, in a more general approach, there are 4 things that you need to pay attention to in the beginning of the when you watch the situation occur. So the first one is security, and then you examine the location of the victim. Then you alert the people, the differentiated help. So you call points one by one for now, but it's very important that you remember SEAF. So security, examine the location of the victim, alerts, and first aid. So about security, your first and most important task is to check the location and see if there are any dangers. So for example, if there's a highway accident and the victim is in the middle of the highway, that's the first thing you need to do, is take them off there, because then his situation is going to deteriorate. So you need to identify any risks. Is there electricity and water around? If there was any problem, is there a risk of fire? And then you create the secure conditions. One thing that's very important is you shouldn't take any risks. So, for example, if you see a fire happening, what do you think you should do if you see a victim screaming inside? What would you do?
Sorry, Laura, can you repeat the question?
If there is a burning building or a burning house and you see someone screaming inside, what do you think you should do? First of all.
Well, have we called the fire alarm or not? If we're not, then call the emergency and then see how bad the situation is.
Yeah, exactly. Because first you examine the security, and if you go in and you don't know how to act in a fire, so you shouldn't try and invent something. Oh, I'm going in, be the hero. You're probably going to get trapped inside, and then you'll be one more victim to rescue when the fireman comes. So it's very important that you check security and that you don't put yourself into any risks to save other people, because if you are another victim, then you're just going to make it worse. So also, you should keep a safe distance in these cases when there's fire, when there's electricity coming, and help evacuate if necessary. Another thing that's very important is that you should be careful with touching blood or fluids, because some diseases are transmissible through blood and fluids. So if you see someone is bleeding or you see any fluids, then you should always wear gloves. And if you don't have gloves at hand, because that's a normal situation, then you can use a plastic bag in your hand so you can help the victim. If you still see that you probably have contact with the fluids, then you can instruct the victim, if they're awake, to tell them, okay, hold the wounds, and instruct them to do what you are going to do. In case you really can't find anything to protect yourself, because you don't want to run any unnecessary risks. Okay. Then, after security, you examine the location and the victim. And all of this will give you clues on what happens. Are they awake? Are they responding, reacting? Are they breathing? And all of this is very important, because you're going to have to transmit all this information to the differentiated help that is coming when you call 112. So also, if they're awake, they'll probably be very stressed and not knowing what's happening to them, very confused. So it's very important that you introduce yourself and you try to make them remain as calm as possible. Ask them how they're feeling, ask them what happens, and tell them you're there for them and the help is coming. And that will already play a huge deal when people are feeling like their health is at risk. Okay, then you call 112, you alert and ask for differentiated help. In Armenia, for Yerevan, it's not 112, it's 103, but everywhere else in Europe, it's 112. And what happens when you call 112? First, the policeman picks up the phone. So you shouldn't start, oh, this happened. No, just tell them first, okay, this is a medical emergency. And as soon as they know it's a medical emergency, they'll pass on the call to medical emergency contacts in 112. It's also important that you stay calm and you describe the situation very well, because the ambulances are prepared according to the situation they are described. So if you know what's happening, the more information you have, the better prepared the help will come. So it's very important to describe any dangers you have spotted, the exact location, number of victims, victim states, and always respect the instructions that you are given. Okay, and then after you've gotten help, you go to the first aid. We'll go through some situations that can happen in first aid, but there are always some rules that you can follow despite the situation. So you should never move the victims unless it's absolutely necessary, because if they have any problem in their spine, if you try to move them, they might get paralyzed or you might make the situation worse. So you should always avoid to move the victims unless, for example, there's a fire coming, something that their position is compromising the help, then you can move them. But if they're in a safe place, then you should never try to move them. Then you wait for differentiated help and you control body temperature. Make sure that they're not too cold, because a lot of the times, since they can't control their body temperature, they can put on a jacket and their body is going through some stress. It's also important to make sure that their hands are not too cold, their feet are not too cold, so because they can go to hypothermia. Any questions so far about the general first aid?
Let's say that we have to move someone. How do we do that?
It depends on the urgency of the matter. If you try to move them as steadily as possible, so if you have 3 or 4 people trying to move them carefully, that would be the ideal, but it really depends on the situation. So if, for example, you're in a highway and it's really dangerous, then move them as fast as you can. If you see there's a danger of a fire, but it's not happening right now, then you can be more careful and try to move them. Yeah, it really depends on the situation. The less you move the spine, the better their back. The more supportive you can be, the better. Have I answered your question?
Yeah, sorry, I muted the microphone. I didn't realize. Thank you for the answer.
No problem. Any other questions about general first aid and the SEAF? No? Coolio. Let's move on then to some specific situations. So the first one we'll talk about is syncope, which is when delegates or someone passes out and gets unconscious for no reason. It's a sudden loss of consciousness then, and before losing consciousness, you can start seeing some signs that might indicate that that person is not feeling so well and that they might faint. So if they're feeling weakness, if they're very pale, if they start feeling dizziness or vertigo, if they start seeing dots when they, if they say they're seeing dots or seeing everything white, then it's probably a sign that they're going to pass out very soon. Same for you, if you ever feel this, you're probably going to pass out. And nausea or chest pain. And if someone tells you that they're feeling this, you should probably start acting on your first aid. The main causes of syncope will be hypotension, so when they have very low blood pressure, which can happen if you don't have your morning coffee, for example. If you haven't eaten, you can have hypoglycemia, and these are usually the main. If you're very tired, if you haven't slept well, those are the main causes of syncope and are very benign. They'll probably have no sequels, no problems, but other things might cause syncope, which are acute myocardial infarction, so a heart attack. It can be a cerebrovascular accident or an epileptic attack, which some of these diseases first, what happens is that they start with a syncope, but that's like the 5% of cases. Most cases will be because they have low blood pressure, because they're tired, because they haven't eaten, because they haven't had coffee. So these are the most common ones. What should you do? As soon as it happens, you check for lesions. Have they fell on their heads? Have they broken arm? Because if you're falling, if you faint in the middle, if you're not expecting it, you can protect yourself. So they might fall and hurt themselves. Eliminate factors that can be causing the syncope. So if they're impressed by something, if something happened if there's anything you can do to eliminate the cause of the syncope. If it's too hot, maybe take them to a place that's not as hot or turn down the air conditioning. And you should untie the clothes around the neck, because sometimes you have some receptors in your neck that can, if you're wearing a tie, for example, it can stimulate the receptors, and the receptors make your blood pressure fall, and that causes hypotension, and you can faint. So you should try and untie the clothes around your neck to help those receptors not be activated, so your blood pressure can go up again. You should always elevate the legs, because what happens during a syncope is that you don't get enough oxygen to your brain, and that's why so you don't get enough oxygen because you don't get enough blood. So if you elevate the legs, then more blood will go to your head, and you'll get the blood you need and the oxygen you need. So those are the first things you should do. So check for lesions, eliminate factors that can be causing the syncope, and tie clothes around your neck, and elevate the legs. Okay, any questions about syncope? No. Okay. Cerebrovascular accidents. It's usually called thrombosis, and it's the second main cause of death in the world after heart attacks. It's cerebrovascular accidents. So it's very likely that you will see or you will know someone that has seen a cerebrovascular accident happening. It happens more to elder people because what happens is that you have the blood vessels in your brain, and when they start to deteriorate, so when you get older, they get less flexible, it accumulates fats, and that may happen. It may happen that they either break or there is a clog that stops the blood flow in those vessels. So there is an area of the brain that doesn't receive blood, it doesn't receive oxygen, it doesn't receive nutrients. So the cells start to die and start to suffer first, and then they start to die. It's mostly about prevention. So don't smoke, do exercise, control your weight, don't drink too much alcohol, don't do drugs, be careful with your hypertension and diabetes. And yeah, your age you can control really, but it's more common in older people. How can you spot a stroke? It's very important to be fast, and that's also an acronym to remind you of the signs that you might identify a stroke. So if you see someone losing their balance, or if they say that they have blurred vision, those are some signs, but the most common ones are the face, arms, and speech. So if you see the face starting to look different on both sides, because your brain controls, each side of the brain controls one side of the face. So if for example, in this hemisphere, there is a lack of oxygen and nutrients of blood, then this side will suffer, but this side won't, because this side is fine. They cross. So if only one side, only one side of the mouth is falling, if only one side of the eyelid is falling, then that's a sign that you should be aware of. It might be a stroke. Also, your arms or legs, if they are, for example, if people are standing and then one leg stops working, or one arm they stop being able to move their fingers correctly, then that's also a sign that it might be a stroke. And if they start speaking and not making sense, so they keep speaking, they might not even be aware that they're not making sense, but if they're saying things that don't make sense, it might also be a very very common sign of a stroke. And then time. It's very, very important that we act fast, because the longer we wait, the more cells are suffering, the more cells are dying, and then it gets irreversible after some time. So the most important thing when a stroke is happening is to call 112 immediately. How you can check if the person is having a stroke is ask them to smile or show their teeth because of the face thing. Repeat a simple sentence, and you can ask them to raise their arms like this and with their palms up and close their eyes, and you count 10 seconds, and if one of the arms starts falling and the other one not, then it's probably a sign that it's a stroke and that you should act immediately. So if you suspect someone is having a stroke, you follow these 3 simple steps, and if one of them is not as it should be, then you should call for help. And what can you do? You can call 112, of course, as fast as you can, place them in a comfortable position, avoid movements, and it's very important that you write down the time the symptoms started, because after some time, like the treatment, specialized treatment in the hospital is different according to the time that has passed since the symptoms started. So before 2 hours is a treatment, after 4 hours is a different treatment. So it's very important that the hospital people know exactly what time the symptoms started. You should also watch closely for loss of consciousness or difficulty breathing that could happen in some cases. Any questions about strokes or cerebral vascular accidents?
Is it okay? Okay, maybe not, but like, is it okay to give people water in this situation, or it's better not to?
It's okay. Yeah, if they ask for it, it's okay. Mm-hmm.
Thank you.
Cool. Let's move on then to chest pain. I'm going to focus more on heart attacks in this case, myocardial infarctions, the technical name. But there are many causes of chest pain. It can be because of anxiety. It can be because of reflux. So it's not always a heart attack. Luckily, the heart attacks are the least common chest pain, but they're also the more serious. So I'm going to teach you how to recognize when it's a heart attack or not, and tell you what you can do in those cases. So a myocardial infarction or a heart attack is caused by the same mechanisms that cause the cerebrovascular accident. So the blood vessels in the heart start getting less flexible, start getting fat accumulated on the artery walls with the cholesterol and everything, and they might clog, so stop passing the blood to the heart, so the cells that need the blood, the oxygen, the nutrients die, and you get a heart attack. The most common symptom is chest pain, and people describe it as if someone is squeezing them or stabbing them in the chest. It can irradiate to the left arm, it's the most common one, but it can also irradiate to the neck, the mandible, or your back, or the stomach as well. So if the thing that it's always to the left arm, it's not always to the left arm, like 50% of the times it's to the left arm, but if they say their jaw hurts as well as their pain, as their chest, it can also be a sign of a heart attack. They also usually have difficulty breathing, and they can lose conscious or be very sweaty, nauseated, vomiting even. You have here a sign of a person, a drawing of a person having a heart attack, so they can be sweating, cold, feeling dizzy, pain, tingling, discomfort, out of breath, pressure. They really describe it as pressure. Someone is pressuring them or squeezing their chest or stabbing their chest. And if you measure their heartbeats, then it's also usually, it can be either accelerated or low, the heartbeat in the wrist. What can you do? You can call 112. You can give them an aspirin to chew. Don't ask them to don't take it with water, because then it's absorbed slowly, and you want it to be absorbed as fast as you can. So you ask them to chew. Also, they can vomit the water. So give them to chew so that they have as least amount of food and water possible in their stomach, so that they don't vomit it. And ask them first if they're allergic, or if the doctor told them never to take an aspirin. Keep them calm and comfortable. Don't let them panic, and watch closely for loss of consciousness or difficulty breathing. Any questions? No? Okay. Let's move on to epileptic crisis. So, epileptic crises are a neurological disease that is caused when your neurons on the brain fire way more than they should. So, it can have many different causes, like really, really many. It can happen at any age, at any point, if it has happened before or not. It's not only epileptic people have epilepsy, it can have many, many other causes. You have two types of epileptic crisis: tonic-clonic seizures, which are the ones that you probably know and that you've seen when people are convulsing, when they lay down on the floor, fall and start moving and get their muscles very tense. Or you can also have absence seizures, which is when they stop making sense. They stop being where they are. They just get very quiet, still, they stop responding, they can be chewing or doing repetitive movements, they can start walking around for no reason without making any sense. And that's also a sign of an epileptic seizure that happens in a different part of the brain from the tonic-clonic seizures. And what can you do? If it's a tonic-clonic seizure, so if they're moving in the ground, if they're not conscious, you should try and lay them down so that they don't fall on their own. You shouldn't stop the seizures. You can't, you really can't, it's impossible. So don't try, or you'll get hurt and you'll end up hurting the person. And you should try and move the objects as far as possible from the victim. So if there's a table, if there are stairs, try and move the victim in a way that they don't hit anything or they don't hurt themselves, because they're not controlling their seizures. All their muscles are being activated. So try and keep everything clear from them so that they don't get hurt. You should also try and untie the clothes around the neck so they don't choke. And you shouldn't try and put anything in the victim's mouth. A lot of people think that they should stop them from biting their tongue. When they start seizing, they've already bitten their tongue. So there's nothing you can do. And to stop them from biting their tongue, the first thing they do is bite their tongues. So if you put something like, I don't know, whatever you find, you might give the victim an infection because they have blood in their mouth. They have injuries in their mouth because they've already bitten their tongue. So you shouldn't try and put anything in their mouth. And you wait until the seizing ends. You count the time until the seizing ends, because if it's more than 5 minutes, you need to call for help, because the neurons are firing so hard that if it's more than 5 minutes, it can have damages later on in their lives and sequels of the epileptic crisis. So you track the time. Yeah. Okay, and then you register the duration and number of crises. It can happen more than once. They can stay conscious and then 5 minutes later have another seizure. So you should always track them and track the time. And stay with the victim until they regain consciousness. They won't remember, so you should explain to them what just happened and ask them if they've had it before, if it's the first time. Try and understand why the crisis happened. But you shouldn't give them any drinks as well, because if they have another seizure, they might vomit, they might choke. So wait for quite a while until you give them drinks. In case it's an absence seizure, so the other kind of seizures that you don't know as well, and so they can have blank staring, they can be chewing, they can be fumbling, wandering around, shaking, making confused speech. That's a sign also of an absence seizure. And you shouldn't try and stop them because they're not conscious, they won't listen to you. You should try and explain to the others so that people aren't like, what's happening. So you should say, okay, she's having an epileptic crisis. It's normal, it will stop very soon. You should try and block the hazard. So if there are stairs, don't let them go to the stairs. If they're walking around, try and stopping them from hitting things. And speak very calmly to the person. Track the time, same as in the tonic-clonic seizures. And when it ends, same as the other one, explain them. They won't remember. You'll tell them what happened and they'll say, no, that didn't happen. You try and explain very calmly to them what happened and try and see if they've had this before or if it's the first time. You don't always need to call 112 or call for differentiated help. If it's the person's first crisis, yes, because the doctors need to see what happened or what's the cause of this epileptic seizure. If it lasts longer than 5 minutes, or if they have multiple crises without regaining consciousness, you should also call 112 because they can have sequels, and sometimes it's important to act and to stop the seizure with medicines and specialized medicines if it's more than 5 minutes. If they've been injured during the crisis, if they fell, if they hit their head, definitely call 112. If they have trouble breathing as well, or if someone's pregnant, if they have cardiac diseases, if they have other conditions that might make it worse, this epileptic seizure, or having these epileptic seizures again, then you should also call 112. If it's someone that's epileptic, then it happens sometimes, and there isn't really a point to call 112 and send them to the hospital, because it's something that they've learned to live with mostly, or something that happens and that they're trying to control in their own way. There's no need to go to the hospital right away. So only in these cases you should call 112. Any questions about epileptic attacks? No? Coolio. Then let's talk about choking. Okay, I'm going to need to call my guinea pig, which is my brother, for this, for me to to show you. Wait a moment. Okay, so choking is when the airway is blocked and the person can't breathe. It has a danger of brain damage and death, so it's very important to try and solve this as fast as possible. The universal sign of choking is when people grab their throats and start gasping, or you see that they're having trouble breathing. They can even get paler, or then later on a bit blue. So you should act then. And what can you do? First thing is you calm them and you encourage them to cough. So it's okay, cough. Okay. And then if they're still choking, then you should ask them to stand up. Wait. You ask them to stand up. You put your foot on front of their feet, so you support them. You ask them to lean slightly forward, and then you beat their back so from down to up movements. So an upwards movement. You hit their backs 5 times while you support them to make sure that they don't fall. Okay? And you do this 5 times. In between their shoulder blades. Then if they're still not okay, then you're going to do abdominal thrusts. How can you do abdominal thrusts? Think. Go here. Okay. You do abdominal thrusts. You feel the pelvic bones. There are these bones here. You try and feel them. And when you identify them, you put one hand in front, like in the middle line of your belly, of the person's belly, in between the 2 pelvic bones. So you find their pelvic bones, here they are, and you put one.
Laura, are we supposed to be seeing you in this moment? Because we're not seeing you, we're seeing the screen.
I can see her. Can others see?
I can see as well. I can see the video.
Yeah, you can change it.
I can. I'm fine with the video.
All right, sorry.
Yeah.
Okay, Ricardo, just, there is like this little screen where you can see probably your face. So if you play, like there are different like thumbnails, and if you just press the second one.
I'm sorry, my bad.
No worries. Okay, no worries. Laura, go on.
Okay, so you feel the pelvic bones. You put one hand in the midline, in between the pelvic bones, and with the other hand, wait, I'll turn him around. With the other hand, you push inwards and upwards, very fast. I won't do it because I will hurt you. Someone is choking. But yeah, so yeah, you can go. So you understood? You find the pelvic bones in the midline, one hand, and with the other hand, you grab the other hand and you go inwards and upwards. Very hard. Don't do this like really at home because you can break a rib or something to someone. So only do it if someone is really choking and if through the back thrusts, it didn't work. So this is a last resource because there is a high risk of breaking a rib. You should try and do this 3 times this cycle. So asking them to cough, the back thrusts, and then the abdominal thrusts. So if this doesn't work in 3 times, call 112, and or if the victim becomes unconscious as well, call the 112. Any questions?
Does the method of hitting a person on the back work or not? Because that's what all of our people, like in Ukraine, do. They just hit really hard on the back. Does it usually work? Or yeah, okay.
Yeah, it usually solves. So if you ask them to cough, that usually solves 50% of the cases. Then 40% more if you hit them in the back from down to upwards, usually in between the shoulder blades. That also really helps. And then there are like these very little percentage of cases that you need to do the abdominal thrusts to to make them expel what they've eaten. Or yeah.
Okay, thanks.
Any more questions about choking?
Yeah, actually, wait, I have a question. Let's say you're alone. Do you know what you're supposed to do?
Oh, good one. Yeah, that's my biggest fear.
Try and cough and get help. Like cough and get help. Like I've heard some stories of like crazy people, because the idea of the abdominal thrusts is that you press the diaphragm. That's the muscle that's under your lungs. You press your diaphragm in a way that the lungs have to expel, like really, they diminish the volume of the lungs and they have to expel the air. And to expel the air, the thing that's blocking the airway has to come out. So I've heard some crazy stories of people like hitting their diaphragms on tables or something, but like those are some crazy stories. I would try and cough and get help. If you are in the middle of absolutely nowhere, you can try and do abdominal thrusts yourself or something in a table, but I wouldn't recommend that as a first, second, or third option.
And what shall we do if the person is like very fragile, like a small child or someone just fragile in general? Is it different or?
If it depends. If it's like a baby, like child, baby, like I don't know, 3 years old or something, be very careful when doing the abdominal thrust, because if you can break a rib to a grown person, then to a 3-year-old you can definitely do worse than that. So like try and use maybe 2 fingers only instead of the whole wrists, and press them in a way to make the diaphragm go up, because in a person you have the abdominal wall that's hard to go inside, but in a baby they don't have the abdominal wall as developed as we have. So if they're a baby, just the idea of the abdominal thrusts is to make the diaphragm go up and force the lungs to expel the air. So in a smaller person, then if you can do this without using the abdominal thrusts, it's much better.
All right, thank you.
Good. Okay, if there are no more questions, I think that we are done. I remind you that before you do your first aid, always check security, examine the location and the victim, and alert first, and only afterwards you can start doing everything you can to provide your first aid. And I think that's it from me. If you have any other questions, any other situations that you've experienced and you want to discuss, feel free to ask me, or we can discuss.
Okay, I have a question when it comes to anxiety and panic attacks, because that happens sometimes at sessions. So what would be your recommendations of how to handle this? If you see someone experiencing it.
I don't think that would require medical attention unless it's a really serious panic attack. I mean, medical attention in the sense of first aid, because unless you have drugs and like calming drugs, there's really nothing you can do medically to try and help the situation. My advice would be to talk to the person, to make them comfortable, to give them some space, to deal with and to ask them if they want medical aid, or if this happens often, if they have any drug that you can that they usually take, and talk to them in that way, because unless you are a doctor, you can prescribe some anxiolytic or something like that. There is really nothing in first aid sense that you can do.
If I can add, from my experience, I think that what really helps is if you have a paper bag somewhere near, because then you can give it to the person and they can start breathing more. And it's sometimes really helpful when you ask one question to the person, like a simple question. And sometimes people say that it helps them kind of come back. Is that if that's like the term you can use, but if you just like ask one repetitive question, for example, like what's your name, this may be easier for them to just like concentrate their mind on something, because it's like a stress and the body's answer to that. So sometimes that is helpful.
Yeah, exactly. The paper bag case, in case they're hyperventilating, that really, really helps. So if they are breathing like this, a paper bag or something that they can breathe into that comes back to them, it's really helpful. Okay, any more questions? Anything else that's happened to you or that you've seen or heard and you didn't know what to do?
I would say you have covered pretty much all the possible situations that can happen when it comes to first aid primarily. And also I would like to add that right now in EVP sessions, more and more, thankfully, officials are having one person who is responsible for the welfare. So once you are calling emergency, go to that person or call them so that they come and also do their job in terms of like approaching the situation professionally. In Yerevan, it's going to be Monica Seidel, who is from the international office, and she is like certified to do this. So in case any of the Yerevan people are wondering who to approach, this is going to be Monica. Yeah, and I guess if there are no other questions, I would like to thank everyone for participating.